I want to take back my power. What can I do? Where are these different things that I could look at? And what I find is a lot of clinicians or practitioners, they're trained kind of in one lane. If you have something happening with your body, you talk to the doctor. And if you have something happening with your mouth, you talk to your dentist. But there's not a lot of people that talk to each other, even though we're talking the same language from different points of view, so to speak.
Hi there, I'm Shanine. As a certified health coach and kinesiologist, I help busy women in their 40s who feel tired, overwhelmed, anxious, frustrated, and stuck to live their best years in great health and balance. Together, we'll explore a life that reflects intentional living and lays the foundation for you to live your life's purpose and flourish in your 40s. Welcome to Becoming You at 40.
If you've ever felt like you are doing everything right, you are eating well, you are trying to take care of your body, but still you are dealing with stubborn weight, low energy, or symptoms that just don't make sense, this episode is going to open your eyes in a completely new way. Because what if one of the most overlooked pieces of your health has been right under your nose the whole time? Today we are diving into a conversation that most women have never had before, but absolutely need to hear, especially in midlife. I'm joined by Christine Horton, a certified health and wellness coach and registered dental hygienist with more than 20 years of clinical experience. But what makes Christine's work so powerful is not just her professional background, it's her personal journey. Having lived with polycystic ovary syndrome since her teens, she understands firsthand what it feels like to navigate symptoms that are often treated in isolation rather than as part of the bigger picture. And that's exactly what she is going to help us connect today. Because Christine's approach is built around one core belief. Women deserve care that connects the dots between inflammation, hormones, lifestyle, and yes, even oral health. In this conversation, we are exploring the surprising and often overlooked link between what's happening in your mouth and what's happening in the rest of your body, from hormonal shifts in midlife to chronic inflammation, energy, and even weight. So if you've ever felt like your body is working against you, or like you are missing a piece in the puzzle when it comes to your health, this episode is going to give you a whole new perspective. If this is the first time here, welcome. And if you are a regular, thank you for coming back. Before we get started, take a few seconds to hit follow or subscribe on your podcast app. It's free, it takes 2 seconds, and it means you'll never miss an episode like today's, where we are uncovering a hidden link between your mouth and your midlife health that most women have never even considered. Okay, let's get into it. Christine, welcome to the show. I am very excited to have you here, and I look forward to today's conversation.
Thank you. I'm excited to be here and have this conversation. I love reaching new audience and women who sometimes are at a loss of what's happening. So thank you for the opportunity.
Absolutely. You are joining us all the way from the USA. Can you please tell the listeners where you are from?
For sure, yeah. So I currently live just outside of Houston, Texas, but I'm
Mhm.
originally from Canada.
Okay. Well, thank you. I'm very excited to have you here, and I'm also grateful that you took some time out of your busy practice to join us for this conversation. Now, Christine, you and I actually have a few things in common. We are both health coaches. wellness coaches, and both of us are very passionate about women's health. And both of us also have a condition that we have struggled with for many, many years. You've been struggling with PCOS since your teen years. I've been struggling with endometriosis for many, many years. And I think that gives us an understanding of women's health and the importance of managing what we can manage to take our health forward. But what I would like to know is you've lived with PCOS since your teens. How did that shape the way that you understand women's health today?
I think this gives me a front row seat because sometimes what we hear in standard care
Mm,
isn't helpful, especially with a chronic disease. This isn't something that one pill, one patch,
mm,
just do this and it's gone forever. I wish it was that easy, but that's not the reality of it. This is
mm,
a lifelong condition
mm,
that um, is hitting multiple parts of your body. And so I
mm,
think that's key, that this isn't just one thing. Now, the PCOS kind of leads us to believe it's just the ovaries or a fertility type thing.
mm,
And in May 2026, it's been officially renamed from PCOS, polycystic ovarian syndrome, to PMOS, which is
mm,
polyendocrine metabolic ovarian syndrome. So,
mm.
what that changes for us and is a benefit is it takes it from really talking about the ovaries and one part of our body to saying polyendocrine, which is many hormones, metabolic, which is how we process food and our blood sugar and all of those types of things. Then there still is that ovarian piece because it is one of the leading causes of infertility in women.
Mm, mm,
And then syndrome, meaning it shows up different for every woman.
mm.
So I think all of those pieces for me has given some recognition to how big and how complex this can be and
Yeah.
how it's not going to be the same for every woman. So I have lived many decades, as ridiculous as
Mm,
that
mhm.
sounds, but when you're diagnosed as a teen, that's the truth
Yes.
of it.
Yeah.
And so I have seen many facets of it as well,
Mm,
personally.
mm,
And it changes as you go through different parts of your life. And I
mm,
think that sometimes people who do not have a chronic condition, whether that be a medical provider, a parent, a spouse, a friend, it's hard to describe how this can affect you in different ways at
mm.
different times of your life.
Mm. And I think it goes even beyond that because for me personally, it also affects, it doesn't just affect your body on different levels, it also affects your relationships. Um, because for me, there was a time in my life where I had to say no for a lot of things, where I wasn't able to
Mhm.
join in with the family and the family activities due to my condition. I'm sure it's the same for many other women, whether it's living with endometriosis or living with PCOS or even any other syndrome that women do struggle with. But looking back, do you think it's your experience with PCOS that helped you understand and make the connections between inflammation, hormones, and your health? I think there's a lot of practitioners that doesn't necessarily make those connections, but you did. Do you think that's because you are living with PCOS that you were able to do that?
Yes, I think so. Because although it took years for me to personally do
Yeah.
it,
Mm,
um, it has never been so obvious when the connection was made for me. And
mm,
by making the changes, because one thing that I find very beneficial for women dealing with chronic conditions is when we're able to know about the things that we can do, not because we're
yes.
looking for the next quick fix, but because everything adds up. And so if
Mhm.
we can add in the positive rather than the negative, we
Yeah.
feel better and we feel more in control, and we feel like we can then choose to do the things that we do have the energy or the time or the
Mm.
space or the feeling well for. So for me, this all kind of came together. I knew pieces of it. I
Mm.
do have to say, from when I was diagnosed through the different times in my life, I had different symptoms. So
Mm.
if you looked at me at 17 or 27 or 37, I presented differently with my
Yes.
condition.
Mm.
And so I think that's a key piece, because as you move along and it's presenting differently, even to yourself, you're like, well, that must be really confusing for, a physician or, a medical provider that you are
Mm.
using to now
Mm.
be talking about this, that. So my aha moment came actually when I hit perimenopause,
Mhm.
because normally in a woman who does not have a hormone condition,
Mhm.
perimenopause can be a time of big change and crazy things that you're like, what is going on? Like, my body's
Mm.
never done this.
Yeah.
But when you have a chronic condition, especially one that already affects your hormones, it is next level. I got to be honest. And so that
Yeah.
was when I really started doing a lot of my own research and, like,
Yes.
okay, I want to take back my power. What can I do?
Mm.
Where are these different things that I could look at? And what I find is a lot of clinicians or practitioners, they're trained kind of in one lane.
Mm.
If you have something
Mm.
happening with your body, you talk to the doctor. And if you have something happening with your mouth, you talk to your dentist. But there's not a lot of people that talk to each other, even though we're talking the same language from different points of view, so to speak.
Yes.
And so, with my background in dental, me going through this long journey with this chronic condition, then
Mm.
having this hormonal cascade of kind of tossing
Mhm.
everything I thought I knew upside down,
Yeah.
it was kind of the perfect storm for me to put all of this together.
Mm.
And then, of
Mm.
course, you do the research and you talk to other women and you look at the studies and you're like, why is nobody talking about this? And
Mm.
this is part of the reason why I became a health coach, because
Mm.
I feel it's really important that other women, even those that don't have the same condition I have, to know about this, because as women, just so many things affect our hormones, affect inflammation in our body, and
Mhm.
those are key drivers to
Mm.
disease, not
Yeah.
just PCOS, but endometriosis and any other that we could list off, really, if
Yes.
we get down to the root of it.
Yeah. Yeah, it's almost like, well, for me personally, in my own journey, but also with the clients that I work with, it's as if
Mhm.
when they hit their 40s and they start going into this phase with perimenopause and all the lifestyle changes, inflammation starts to speak louder. It's
Mhm.
not that the inflammation maybe is new. It might be that they are living with inflammation for a long period of time without necessarily knowing it, but suddenly your inflammation is speaking louder and your body needs a response. Your body is asking for help. Your body is communicating with you in this phase of transition when we are going through that hormonal changes. So, do you see similarities between what a woman with PCOS experience and what women that are going through perimenopause experience?
Yeah, there's a lot of
Mm.
overlap between the
Yes.
two. So, one we kind of touched on was the inflammation. I think that
Yeah.
becomes a bigger part. I don't think that it comes on, like you said, just when perimenopause happens,
Mm,
but I
mm,
do think it might be years or decades of it being an
mm.
underlying thing. And then it kind of comes to a point where something needs to be done. It's no
Yes.
longer just staying in the background, it's now becoming a forefront runner, so to speak.
Correct.
As
Correct.
well, there a lot of women with PCOS and a lot of perimenopause women often will start having issues with insulin resistance, or
Mm,
how our body is processing our food. Then we have the weight changes, which you hear a lot of women talk about. Like all of a
Yeah.
sudden in perimenopause, they're like, I don't know what happened. I'm doing the
Yeah,
exact same things I've been doing. And
exactly.
all
Yeah.
of a sudden, like I've got this midsection that,
Mm,
just won't budge. And again, that can be the same thing. So what changes and what's similar is that our bodies aren't necessarily responding the same way to the things we were doing before, how much sleep we were getting, maybe what
exactly.
foods we were eating,
Mm,
maybe how much exercise we were or weren't getting, maybe how much alcohol we were or weren't
mm,
drinking. All
mm,
these things now become factors.
yeah.
And as well with PCOS or perimenopause, they're both hormone transition times, right?
Mm, mm,
So again, what we were doing, our body can have a different response because it's already going through something.
mm,
um, and the final point that I kind of want to make on these similarities is that no two women's journey is exactly the same. And I
yeah.
think that's really important because sometimes we think, well, our neighbor who's the same age as us, they don't have any of this. Why do we have all of it?
Mm,
You
mm,
can't help but kind of do that. Um, but everybody's an individual. Everybody has individual circumstances and things
mm,
that they are or aren't doing. And we
mm.
just need to hold space for that and know that no two things ever show up exactly the same in any two women.
Exactly. I think that's very important. And I think it's important like you said, holding the space and acknowledging what you as a woman are going through really matters. And each woman need to get their own sort of attention. They deserve their own attention for
Hmm.
wherever they are and for whatever they are experiencing at that moment. But you specifically focus on connecting inflammation and hormones and lifestyle. Why do you think inflammation is such a centerpiece? It's like the most important piece of the puzzle, and specifically for women like us with either hormonal conditions or just in midlife going through perimenopause.
Right. So, inflammation is a driver of many other symptoms. So,
Mm,
there's not very many women that wake up one day and say, I think I have inflammation. They notice the symptoms that they don't like, right? So it might
mhm,
be the weight gain around the
mm,
middle. It might
mm,
be they notice that they're a little puffier. It might be
mhm.
that they notice they're not recovering like they once did. Maybe they didn't get as much sleep as they usually do, but before they could just pop out of bed and whatever, they'll catch up or try to
Yeah.
catch up, which you can't, but you try to.
Mm,
You know what I mean? Where
mm,
now they're
mm.
like, I can't even get out of bed. Like
Exactly,
I want to get up, but I can't. So
Mm,
those are all kind of like little sneak peeks at
mm,
inflammation playing underneath. And so it's really something that you want to look at because what inflammation does, we have two kinds of inflammation. I guess I should say this. We have two kinds
yeah.
of inflammation in our body. And one type we absolutely need. If we skin our hand, we need our body to hop in there and, stop the bleeding and form a scab. And
Mm,
it takes
mm,
care of it and it's over with. That's not the
mm.
type I'm talking about. We need that.
Yeah.
The type of inflammation I'm talking about is the chronic, long
Mm,
term that isn't being resolved. And so, one place that obviously I am well versed in is your oral health or your
mm,
mouth.
mm,
So, what that might look like in your mouth inflammation is maybe you're doing the exact same thing you've been doing for your mouth care for 20 years and you haven't had any cavities and you go to the dentist fairly regularly and there's nothing too major. But all of a sudden, like your gums are just kind of a little bit red or a little
mm,
bit puffy, or maybe they're sore in the morning. That's all little signs of inflammation that are specific
mm,
in the mouth. And that's one of the key points is that it is one of the few places in the body that we can look for inflammation, that we can just look in and see. It's hard to say, do we have inflammation in our heart? We're not just going to pop open someone's chest to take a
Yeah.
look,
Yeah.
but it's easy to open your mouth and see, okay, do we
Mm.
see any signs of inflammation in there?
Mm.
And for the vast majority of women, there is some level of inflammation. And in the mouth, we kind of have two areas that we look at.
Mm.
One is it's called gingivitis, and it is reversible inflammation.
Mm.
So it is maybe you haven't been brushing quite as much. Maybe you went on vacation and you forgot your floss. Those types of things
Mm.
where it's
Mm.
just a little
Mm.
irritated.
Yeah.
But you go in, you get the hygienist to tidy everything up and really disrupt the bacteria, and you kind of take over at home, and you can kind of reverse that. That's kind of a
Yes.
quick process.
Mm.
But if that doesn't happen, often we're looking at another disease process called periodontitis.
Mm-hmm.
And that is not reversible, and it is chronic inflammation, and it affects not only the tissues, but it actually affects the bone around the teeth.
Sure.
And so, just to kind of give you some numbers so that
Mm-hmm.
we can put this into practice, statistically, for women over 30,
Mm.
about 40 plus percent have periodontitis,
Sure.
so of some level, and then gingivitis even more so. So
Mm.
most women have some sort of inflammation coming from their mouth. And so
Wow.
that is really key if
Mm.
you are having other health issues, if you're noticing some of those things that I mentioned, to really have someone take a deep dive and look at your mouth. And we have tests that we do that can very much tell you whether you have inflammation in your mouth.
Mm.
One
Mm.
thing I would say for women is you need to advocate for yourself. When
Mm.
you go to the dentist, a lot of people, they're very nervous. That's very common. There's nothing wrong with that. But I think sometimes as dental professionals, we're trying to make it easier, and we're trying to make it in
Mm.
more manageable terms. And so we don't use proper terms, or we don't give you a full explanation, and we're
Mm.
trying to be kind and not scare you, and
Mm.
we already know that it's a place that not everybody loves to come.
Yeah.
But in some ways, I think we do a disservice because women don't know how serious it is or how much it could
Mm.
affect the rest of their body, right? So
Mm.
it's not
Mm.
just about your teeth, it's not just about your gums. There is direct correlation between inflammation or disease in the mouth affecting
Mhm.
your cardiovascular status, right?
Mm.
Um, your insulin resistance, diabetes, all these things are correlated back to disease, inflammation coming from the mouth. So, when you see your dentist or your dental hygienist, what you want to ask is what your periodontal status is.
Mm.
And there is tests that they can do, and usually it involves a periodontal probe, and they just check the measurement between where your tooth meets the gum. And
Mhm.
a normal range would be 0 to 3 millimeters with no bleeding,
Mhm.
but it can go up from there. And then from there, they can stage it and grade it. And so that's what you want to know. What stage am I and what grade am I?
Okay.
Because that tells you more information about, do I have the disease? What level of disease do I have? How much
Mm.
inflammation do I have? And then what that looks like to treat it and resolve it. So
Mm.
those are the
Mm.
important things that you'd want to talk to your dentist slash dental hygienist about, to know if you have inflammation in your mouth.
Now you take that information, mouth information, you take it a step further and connect it with systemic health. Like you mentioned just now, a lot of inflammation in the body, a lot of systems are connected to your mouth, like your cardiovascular system, etc. And a lot of women, I think, when they think about mouth hygiene, they only think about brushing and flossing to prevent cavities, right? So we never think about taking care of your mouth to prevent systemic inflammation or to improve your systemic health. But you say that oral health is connected to hormones, it's connected to inflammation, and it's even connected to, it can even affect our weight, etc. Can you explain exactly how that connection works in simple terms?
Right, for sure. So let's start with inflammation. Inflammation from anywhere in your body affects everything else.
Mm,
So it doesn't matter the source. If you have inflammation, it's going to affect everything. And when I think about this, it's kind of like a triangle. We kind of have 3 points
mm,
to the triangle. So we have inflammation at one point, we have
mhm.
hormones at another point, and then we have the mouth at the third point.
Okay.
And any one of those points affect the other ones. And
Mm,
so, for example, with hormones, we can talk about perimenopause because I think that's
mhm.
a good time, but know that we
Yes.
could exchange that for when you're newly pregnant,
Mm,
as a
mm,
teenager, anytime we have a major hormone shift,
mm,
we can find in a woman's mouth that what they were doing, their body responds different. So, this is someone who has been taking care of their teeth the exact same way, and the
mhm,
only change is their hormones have made a big shift. So,
mm,
the best example I can give you that is the least amount of explanation is with pregnancy.
mm,
Over
mm,
50% of women that become pregnant are going to have some inflammation in their mouth. And it's not that they stop doing what they were doing, it's just that their hormones change all of the sudden. And that's
mm,
kind of the factor.
mm,
So we see that very clearly that that's all that changed, just the hormone levels.
mm,
And
mm,
so we know that it is a key part. Now, when
mm.
those hormones change again, right? When they have the baby and they go through postpartum, for example, or
Yes.
when we finish going through perimenopause, it can go back or it can have a new normal depending on what the hormones do, right?
Mm, mm, mm,
But in the in between time, there's things that we can do because these are all correlated. So if you have a positive change in one area, it affects the other areas as
mm,
well.
mm,
And so when we talk about like insulin resistance, for example, that is like how our body processes the food, the glucose, how our
mm,
cells do
mm.
it. And so with insulin resistance, the cells aren't able to effectively use the glucose. So
Correct.
the glucose is there, but our cells aren't able to access it.
Mm,
And so
mm,
sometimes this is what happens to women in perimenopause, women with PMOS. It's a big factor, about 70 to 80%, depending on the literature, have this happening. And that's a whole other piece. But if it's part of our story, because
mm,
it's going to cause inflammation,
mm.
um, we need to address it because what happens is if we don't, the cells start screaming louder because
Yes.
they need to food so that they can do what they want. And so
Mm,
women will describe this as intense cravings, sometimes for
mm,
really
mm,
sugary things or really high carbohydrate things.
mm,
So if you have those kind of things, that might be something that you want to look into. Is insulin resistance or type 2 diabetes is another one where we have this kind of the cells aren't reacting and they don't
mm,
take
mm.
that easily. They yell louder because they
Yeah.
want it. And so it starts this circle of dysfunction. And
Mm,
that plays into the inflammation piece when we're talking to that whole triangle that I started describing, where we have the mouth and inflammation and our hormones. So
mm,
everything plays a part and it all
mm.
comes back together.
Mm. Yeah, we in kinesiology we also talk about the triangle of health, and we
Mhm.
connect the physical body with the emotional body, and we connect that to the biochemical input into the body. So,
Mhm.
and I think it's the same here, because inflammation can also be worsened by what we actually feed our bodies, the type of food we eat, the how we take care of our physical body. Do we exercise or not? All of those things play a role, and if you can address one and improve one, the rest falls into in line. But if one is out of balance, like you mentioned with your triangle as well, if one is out of balance, it knocks all the rest out of balance, and then it's got this snowball effect, and it can either positively or negatively impact your health. And I mentioned it earlier, but I still want to ask you as well, have you also experienced that a lot of women, when they, especially when they reach their 40s and when they are going through this hormonal changes, that they have actually lived with chronic inflammation for a long time without realizing it? Have you also come across women saying, no, it's just me getting older, and as if they can't recognize what they are feeling and what they are experiencing as inflammation?
Yeah,
Mm.
absolutely. Yes, and I think we all can see that, unfortunately, not just with inflammation, but with other things as well. Like, it was like,
Mm.
"Oh, I didn't know that," but now when I look back, yeah, that was a major
Mm.
thing, and I wish I would have known earlier because I could have done this, this, and this. And
Mm.
that's to your point when you're talking about health and how that all works. That all plays into when we look at root cause things with chronic disease, with
Mm.
inflammation, right?
Mm.
I think a big underplayed part, we know diet, we know exercise, we know all those things, but
Mm.
I think some women really downplay sleep. Sleep
Absolutely.
is
Mm.
so, so, so huge.
Mm.
Um, you don't have to work to deserve it. You need it.
You
Your
need it,
body needs
absolutely,
it.
yeah.
That's how it repairs itself. So when
Mm.
we look at it from an inflammation lens, if you're not sleeping very much or in very small amounts, which again, perimenopause is a time when maybe you've always slept really well, but now you're disrupted because you're having hot flashes or you got to go to the
Mm.
bathroom or whatever it is.
Mm. Mm.
It can really affect all these other things,
Mm.
including the level of inflammation you have in your body.
Yeah, I also see
So,
that a lot. Sleep is
mhm,
so important. But
yes.
I just want to also ask from a dental hygienist point of view, is there specific symptoms that women start experiencing when they enter perimenopause that are actually indicating a hormonal imbalance that they might, need to look out for?
Yeah, it's different for
Mhm.
every woman, and what is true for one might not be for the other. But some things you
Mm.
might kind of point you that way would be those bleeding gums, those sensitive
Mm.
gums that weren't previously, or an area that just doesn't seem to heal. Maybe
Mm.
you burnt the roof of your mouth because you had some hot soup, but it
Mm.
just
Mm.
isn't healing. Why is that? Maybe some increased sensitivity, just overall, just it doesn't feel quite right in there. Dry
Mm.
mouth is another one. There's other
Mm.
causes for these things, but this is something that you would want to, talk to your dentist about and
Mm.
see if this is the root cause for you.
Mm. Mm. No, I think that's the key thing. I think we must understand that we need to have a conversation with our dental practitioners. And I think a lot of people go to the dentist and they only speak cavities, or they only speak pain in the mouth, but they don't necessarily go in with a holistic point of view and talk about other symptoms that they are experiencing, which might be connected. So I think that's an important takeaway there. Now, from your experience in your personal journey, but also as a wellness coach in your practice,
Mhm.
I'm sure that you have identified some lifestyle changes that have a very big impact on inflammation. I know for me personally, and especially when I reached 40, I had to make a lot of lifestyle changes, and my whole outlook had to change from just trying to cope to living my life intentionally and making daily good choices. So I would
Mhm.
love to hear what lifestyle changes you have identified as, having the biggest impact on inflammation specifically.
Yeah, absolutely. I will say this is very personalized and
Mm,
different things are
mhm.
going to affect different women.
Yeah, no,
For
that's
me
true.
personally, yeah, for me personally, I do have insulin resistance. And so I have to
Mm,
be very mindful about exercising
mm,
regularly. I
mhm,
have to be very intentional about what I eat and how I
mm,
eat and how I pair things because I am trying to help my cells so that they can get that glucose and use it
mm,
efficiently.
mm,
Um, I have made the choice. I don't drink alcohol anymore because the latest research coming out is just a real cause of
mm,
inflammation and I already have high inflammation in my body and so
mm,
that is just a choice that I had to make. So those are a couple things that I have done that are very intentional that I've had to look at and that work well for me. It's
mm,
not the
mm,
same for everyone. When I work with women, I tell them wellness or health is a journey. Um,
mm.
there's no perfect one, and it doesn't have to look the same for everyone, and it doesn't have to be
Correct.
the same every day.
Yes.
But we have to see what is giving you the most bang for your buck, so to speak. What
Mm,
what
mm,
what things. And so we really look at coaching as experiments. Like, let's try this for a week and see how you feel. Let's see how your body feels. Let's see how you
mm,
react. Are you still have stiff joints? Are you still,
mm,
when you wake
mm,
up in the morning, feel like you haven't slept even though you got 9 hours of sleep by chance that night? Those
mm,
types of things. Because we are individuals, we're at
mm,
different stages, and different changes will affect different women differently. And I
mm.
think that's really key because a lot of times when we go online, we're looking for that one thing. You're on social
Yeah.
media and it's like, oh, if I just eat this way, if I
Mm,
cut out this thing. In all honesty, we have to have a level of efficiency in multiple areas. I like to say that we can't out eat a lack of exercise. We
exactly.
can't
Yeah.
exercise
Mm,
to the point that we don't even have to look at food. So we need a level of efficiency in all of these
mm,
multiple different areas for it to be able to build. And so
mm,
when you talk to women, obviously we do intake and we look at all these different areas. And it's just opportunities to explore. There's
mm.
no right or wrong. There's no you have to do this or you have to do that,
Exactly.
but
Yeah.
it does show where there's areas that let's see if we can mix this up and see if you can get some results. And that's where that one-on-one really works well.
Correct. Yeah. No, Christine, that's so true. And I think, yes, obviously it's very individualized, but I love what you said that there's no quick fix. First of all, there's no one size fits all, but second of all, there really isn't a quick fix. It's about building. It's about building small habits and building from step one to step two, step to step three, and just taking those small steps. And sometimes even a small improvement in your lifestyle can have a very big impact. And it doesn't have to be too hard or too overcomplicated, but making the choice to live intentionally has a big payoff. And I think that's the message that we want to put out there, for women, and give them the hope that they really don't have to go through life feeling bad about themselves, feeling tired, feeling exhausted all the time, and not feeling healthy. They can have a wonderfully healthy life after 40, but it does take a little bit of effort, and there's a lot of support available. You support a lot of women. I support a lot of women, and I think that's also that brings hope to women, so they can know they don't have to do it alone. What would you
Absolutely.
say? How often do you think women should actually visit their dental professional and have their dental health looked at, especially when they are in their midlife?
Yeah. So the standard is every 6 months,
Mm,
unless you have high levels of certain bacteria in your mouth,
mm,
or you're dealing with disease, you're in an active disease cycle and you're trying to manage that, then it can be a 3 or 4 month recall. So
mm.
again, I hate to keep saying it's very personalized, but it
Mm.
really
But it
is.
is, yeah.
Yeah, it is. And so you want to talk to your dental professional about that.
Mm,
There's even some women who have limitations, maybe their manual dexterity, their hands, maybe they have arthritis in their hands and
mm,
they
mm,
just aren't able to brush or floss like they want to. Maybe
mm,
their dentist is going to recommend, you know what, you come in every 3 months so we
mm,
can manage this better and help you so that we can do that. There's circumstances like that, and so that's why it's just
mm,
really individualized.
mm,
But at
mm,
least every 6 months, you'd want to
mm.
see your dental professional.
Okay. I have one last question for you, Christine, and I would love to get your view on what do you think true health looks like, especially if you have to compare it to when you were first diagnosed many years ago. How would you describe that?
Yeah, for me now, true health is when I am able to be in that healthy range in all
Mm,
the um, tests that we have, your blood pressure, your A1C, your BMI, all of these things that we medically are looking at.
mm, mm.
And I am able to live the life that I choose.
Yes.
And I feel well. I
Mhm,
feel good in my body.
mm, mm,
I think that is like the ultimate test, because
mm,
when you have chronic disease, I don't want to wake up every day thinking about whatever aspect of it. I want to do the
mm.
things, so it's just a piece of that I have to manage, not
Exactly.
every day at two
Yes.
o'clock I'm googling whatever,
Mm,
or going to chat GPT and
mm,
trying to figure this out. So for me, that is health now. When I was
mm,
first diagnosed, I was very young, and so I
mm,
was just like, what does this mean for my life? Like, what's this going to look like? Because there's lots of scary, you're at higher risk of heart disease, you're at higher risk of diabetes, infertility, you could just go on and on. And that's very
mm,
overwhelming as
mm.
a 17-year-old to just hear all this negative, 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 negative.
Yeah.
Um, but for me, that is the picture of health now. And I, like every other woman, am learning all the time. We're getting new, very good data coming
Mm,
out.
mm,
And so then I can tweak using that. How does that work with my body? What do my labs show? What is
mm,
my A1C? What is
mm,
the level of inflammation in my body right now? Those
mm.
types of things.
I love that. Yeah, you are painting the picture of someone that is in tune with their body. So they are
Mhm.
listening to their body and they are responding kindly to their body. And I think that's a
Mhm.
big takeaway. So thank you so much. Christine, this was a delightful conversation. And I just want to say thank you for educating us and giving us the information that empowers us to take better care of ourselves. Thank you for being here.
Thank you for having me. I appreciate it. I enjoyed talking.
Thank you. And I hope that this has given you a completely new perspective on your health. Because if there's one thing to take away, it's this: your body is not working against you, it's communicating with you. So if you've been feeling stuck and frustrated, or like you're doing everything right, but still you are not seeing results, let this be your reminder that it's not about trying harder. It's about understanding your body better and supporting it more intelligently. If this episode resonated with you, I'd love for you to take one small step today. Whether it's paying attention to a symptom that you've been ignoring, or booking that dental appointment, or simply becoming more curious about what your body is trying to tell you. And if you know of another woman who's been struggling with her weight, her hormones, or her health in midlife, share this episode with her, because this is a conversation many women need to hear. And finally, if you are ready to move away from the all or nothing thinking and start approaching your health in a more connected and sustainable way, I'd love to support you. You can find all the details on working with me on my website at www.dianucare.co.za. And make sure to also sign up for my newsletter to receive your free eating plan, which will help reduce inflammation by balancing your blood sugar. Thank you so much for being here, and I'll see you in the next episode. God bless and keep well.
Back to school is busy enough. The last thing you need is shopping that makes it harder. Whether you're moving into a dorm, your first apartment, or just getting organized for the semester, Wayfair makes it easy to get everything you need in one place. Furniture, bedding, storage, decor, study essentials, all at prices you'll love, with fast shipping before move-in day. Get everything you need for back-to-school season. Shop Wayfair.com today.
Wayfair, every style, every home.